Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest pediatrician bestie, Dr. Lauren Boehm, who is a practicing pediatrician in New York City. Hi, Lauren, and thanks for joining.
Hi, Jess.
So today, we are going to talk about fever. The clock is ticking, so let's get to it. Lauren, I think a good starting point is, what is a fever? What is the definition of fever?
So most of the time, a fever is the body's response to an infection. So 100.4. So a fever is not anything higher than 98.6, and it's not 100.3, it's 100.4 and above. And so if your child feels warm to the touch, usually you can tell touching their forehead, you want to take that number to know whether it's a true fever, whether it's above 100.4.
All right, so how high does a fever have to be considered dangerous?
So this is the interesting thing. There is no height. There's no number of fever that is dangerous. I get calls all the time for a 105 fever in a child. That is not dangerous. Fever is just the body fighting infection. And children's immune systems fight infection with fever more than adults do. So they can really turn up the heat in their body, and that's because they can kill all sorts of infections by turning up that heat. So even a 105 fever is not dangerous for a child.
Wow, that is really good to know, because I know if I saw that my child had 105 fever, I would probably freak out. But it's good to know that that is not in and of itself an emergency. However, there is one very important exception that we have to call out.
Right. This is a big exception, a big exception. So fever is an emergency in a newborn. It's an emergency in a newborn. For a newborn under the time that they get their 2-month vaccines, if you have a rectal temperature, because that's the only way to take it, of 100.4 or above, you have to go to the emergency room right away. And that's not because fever actually is the problem. It's because infections are the problem, because we don't want that newborn to be fighting an infection. For us to fight infections, that's one thing. For a newborn, they need to be seen to make sure it's not a serious infection, because their immune systems aren't that developed yet. So for newborns, for anybody under 2 months, a fever, 100.4 or above, directly to the ER.
Got it. Okay, so let's say we're not in that situation. We're not in the ER. We're managing our child's illness at home. They have a fever. What do we do about it?
You can give Tylenol or ibuprofen to make the child feel better. But the reason that you're doing that is not to make the number normal, right? So you're not giving ibuprofen because of the 104 fever. I've seen kids in my office running around with 104 fever. They feel fine. They don't need ibuprofen. You're giving ibuprofen or Tylenol to make them feel better, because sometimes when you have a high fever, it gives you a headache. It makes you feel awful.
And so just to confirm, you can give Tylenol or ibuprofen to children over the age of 6 months. Is that right?
You can give Tylenol or ibuprofen, but ibuprofen only if they're over 6 months.
Got it.
And then what you keep track of at home is how long the fever lasts, right? It's not what the number is before ibuprofen or after ibuprofen, or how high even the temperature is. You want to know how many 24-hour periods the child has had an elevated temperature, a temperature above 100.4.
At what point, like how many 24-hour periods then signal, okay, time to call the doctor?
So people say 3 days, but I prefer to think of it as 72 hours, right? 3 24-hour periods. Because then if it's a Tuesday night, you're not going to hit 72 hours until Wednesday night, Thursday night, Friday night, right? So Saturday morning, you want to bring to the doctor. The reason for that is not because fever becomes dangerous at that time, but because once fever lasts that long, it might be not just a virus. But fever doesn't become dangerous. It's just that the infection causing it, we need to know what it is.
Got it. So it's not the fever itself, it's the virus and whatever is causing our child to be ill.
Most of the time it's a virus, but once the fever is going on for more than 72 hours, we need to make sure it's not a bacteria. That's the reason.
Because bacterial infections potentially could warrant something like an antibiotic.
Exactly, because you might need something other than just fluids and rest if you have a bacterial infection.
And reminder for folks that antibiotics are not effective against viruses.
They are not.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.